Are we good? Can I start?
Yeah.
We're good. And camera on. Hi, everyone. Everyone, my name is Erin. I'm a nurse practitioner here at the Florida Center for Hormones, and it looks like we have one patient and our nutritionist. So this is very exciting. And someone else just came in. This is great. Okay, what should I do? We're going to continue. Okay. I made little notes about what I wanted to say before we got started. So you'll notice I'm also a PhD student of the International Institute of Clinical Sexology. This is down in Miami, and I really appreciate you guys being here. You could have chosen something else to do, but you supported me. Mar is like, but I'm drinking, so it's fine. It's great. I want to be here. I love it. Hello, how are you?
This way.
Is he with you?
This is
Awesome.
for you.
Hang on, we're gonna play limbo 1 second. Welcome, Johanna's husband. We're happy you're here. I'm Erin, nice to meet you. Cool, we love her. She's great. We love you too, but we just don't know you. So, okay.
I love her too.
I know. She's great. So I just want to talk about the fact that I'm thankful that you're here. Because again, you could have chosen something else, but you're here, and we do have alcohol, so that will make the night a little bit easier. So it's going to be great. But also, I want to tell you, when I first started the PhD program, I was pretty cocky about it. I was like, what could I possibly learn that is new that has to do with sex? Do I not know all about it already? Thank you, Mar.
You know everything.
Thank you. But that wasn't the case. I mean, every day I am continually humbled and shocked by how little we know as a society, and I think me, myself, as an individual, how little we know about sexual satisfaction. So this is very exciting for me, and I'm really looking forward to taking my medical knowledge and clinical sexology knowledge and putting it all together and coming up with a methodology to change the world and make people have a lot more sex. It's going to be very exciting. I'm really, really happy about that. I do want to say, and Doc and Mar, you guys can speak up here. At the clinic, we focus mostly on hormones, but also we do offer a lot of sexual wellness things here. Do you guys want to just talk about those at all briefly? Do you want to mention? No, not at all. Doc would like to continue drinking. All righty. No. So I'm not going to cover any of those tonight. I'm going to talk about kind of everything else that involves sexual wellness. So that's, I think, what I'm going to say. Sorry, I just made these quick last notes here. I think, again, Doc and Mark can support me here. Patients that are here for menopausal treatment, they're not just surviving, they are thriving. And that is the most amazing thing. And that is what I love doing every day, is just making people feel well. So let's get started. I think that's all I'm going to say. I apologize, my voice is so hoarse today because I did so much charting all day long. So it's like, feels like it's going to keep going out on me. So hang on 1 second. Let me just, I know. I think it's because I increased testosterone. So I apologize. I'm going to have to keep taking sips just so my voice doesn't go out completely. So I think we should start with the definition of menopause, which is, this is the formal definition, a loss of ovarian follicular activity, which results in menstruation cessation, and it's a transition from being able to have kids to not being able to have kids. Okay, so here in the clinic, we diagnose menopause when women have not had a period for 12 months. That's the formal definition. You can't be bleeding in between. We're not going to diagnose you as menopause. So you got to go through the whole change. Now, I chose this picture because if you search on Google and you type in sex after menopause, this is a picture that comes up.
Yoga.
I mean,
Swap yoga for sex.
come on. if anyone,
That more facing the
listen, you know, Mar's been drinking. It's great. But I think any of us who have either gone through menopause, who have seen a patient in menopause, they know that this is not the majority. This is the minority, okay? Menopause is a hell of a transition. So I wanted to collect some things that maybe better represented menopause here. Menopause, a thin line between love and homicide.
Yes.
I think that says
In a
it.
split of a second.
It is, because you don't know. This one, brace yourself. Menopause is coming. Yes. See, you're laughing because you know. Absolutely.
Yeah.
And let's not forget, nobody got time for that. She knew exactly what she was talking about. And if it's a heterosexual relationship in the bedroom, this is what it is every night. Every night. It never changes. This is it. So let's see, what are the lovely, sorry, Clayton, the lovely symptoms that you could get in menopause. These are just a few. We've got some hot flashes, some night sweats. Hey, you're not going to sleep good. You may have a little itchy ear, night sweats. You might feel overheated. Your muscles are going to start to thin down. Your breasts will sag, and you're going to gain some weight. You're going to have some dry skin. You know, your bones will break, so don't worry about that. A lot of fungal infections that are difficult to get rid of. Loose, pulpy soles of the feet. Low libido, no sex, guys. You're not going to be able to predict your menstrual cycle, or it'll be completely gone. That's more like perimenopause. Burning sensation, either when you're having sex or when you're peeing, you're going to get a lot of UTIs. Don't worry about that. Vaginal dryness, yes.
So normal.
It's all normal.
It happens.
It happens, right? Sweet cravings, but remember, you can't lose weight, so that's awesome. You get to see the visceral fat get bigger. You have trouble going to the bathroom. Indigestion, who doesn't love a little acid reflux? All right. Bloating, heart palpitations, emotions are going to be all over the place. You might kill your husband. You might not. You don't know. It depends. Thyroids, you never know. Could be a hyper or hypo. I think we see mostly hypo. Am I correct? Do we see hyper ever?
No, it's not ours. I wouldn't call it hypo. We call
I know
thyroid
I know what we call it, but I'm just saying, yeah, we never see anything where it's overactive.
No Graves' disease.
No Graves' disease.
That's for sure.
Thinning hair, absolutely. We see that a ton. We see headaches. We see loss of memory. Menopause looks just like that first picture I showed you with the women going to yoga. It looks fabulous, doesn't it? I wanted to take the time to actually say every single one of these symptoms because menopause is so unique to each individual. A woman can come in saying, I'm getting frequent UTIs, and that's it. A woman could come in saying, I have every single one of these, and I feel like I'm dying. That's a lot. So I just wanted everyone to be aware, be on the same page as to what we're dealing with. So I thought to myself, so if I'm a menopausal woman, the first thing I'm going to do is contact Dr. Google, and I'm going to say, what do we do? So I literally did that, and I said, what comes up? Because I'm just curious what women are actually getting. So the reason why I chose this one is one of the first ones is written by an OBGYN. She must have something important to say. And this was also reviewed by a PhD who's also a counselor. So it's got to be important, right? Let's see what they said. Rediscover what libido means to you.
Oh,
This is from our OBGYNs. I mean,
For that.
no, that's what I'm saying.
Exactly.
Bring in the cavalry for symptom support. So
The
this
cavalry.
means, yeah, a lot.
Does that mean us?
No. They mean like if you're having anxiety, depression, get medication for that. If you're like whatever it is, like you got to just get the medication you need for all the symptoms. And then they're saying there's no shame in rebalancing yourself with medication. So what they mean by this, sorry, my throat is
No
so,
hormones, medication.
yes, medication.
That makes sense.
But she did mention that you can use estradiol cream. That's okay. That's perfectly fine. She's cool with that, but only a little bit and not too much.
For a little bit, for a short time.
For a short time, and please stop it afterwards. Okay, so that was that. Here's another one that I found, Johns Hopkins. That's a great place. They must be smart. They must know something. But they don't. This is what, I'm not even kidding. I read through every single one of these articles. Isn't this insane? Dr. Kraft, number one, this article was written by a man. I didn't like that. No offense to the man. I'm just saying, it's menopause.
But then they complain when there's the lesson.
They,
Like the question and the no, then they complain about it, but this is okay.
it's natural,
Makes no sense.
according to Dr. Kraft. Make sure you maintain intimacy too. When you don't want to have sex.
Movies, more cruises.
Right.
Scratch my back.
That's it. All right, I got one last one here. Cleveland Clinic. I was like, this is a great, place. I couldn't find who wrote this article or what happened. So I assume this is just a combination of a bunch of people working together. So this is pretty promising. A decline in estrogen can cause intercourse issues, but treatments can help. That sounds pretty hopeful. Okay. Use vaginal lubricants, which, okay, we know that. Or vaginal estrogen. Well, that's one of the decent things that I've seen offered here. But they, again, shortest period of time, lowest amount possible, stop it as soon as possible.
What is that?
You know what it
You
is.
don't want to have sex anymore.
Yeah, exactly.
Your husband.
And this one, number 2, killed me. Seek help for painful sex. Thank you. I would know that. All right.
Stop reading this article.
Right, exactly. I mean, these articles are hilarious. I just couldn't believe it. Work on increasing your receptiveness to sex. Yeah, but if I don't have enough testosterone, it doesn't matter what I do. There's no way, right? Don't give up on sex during menopause. Thank you so much, Cleveland Clinic. Don't. Keep
Don't give
going.
up.
We've got...
But they don't give you the
No, there's no and, Doc. You have to, that's it. The article ended. That was it. I'm sorry.
It's an Alfred Hitchcock movie.
It is. You just don't know.
kills you.
I'm sorry.
Literally.
So, all right, I just want to give you guys some hope. This is what we're going to learn tonight. We're going to learn how hormones affect libido. We're going to learn 5 things needed for sexual satisfaction. So this is part of my thesis that I really want to introduce to you guys, and so you see what I'm thinking. I want to talk about causes of climax challenges. I want to talk about how sexual beliefs limit your pleasure. And I want to talk about how more routine leads to more routine. Keep doing the same thing, you're going to keep doing the same thing. Indeed. So, let's see here. I'm going to just do like a very general overview. So, estradiol, this is the main female hormone. This is responsible for the menopausal symptoms, so the hot flashes, the night sweats. But it's really responsible for a lot of the stuff on that first diagram that I showed you. So when you replace estradiol, most of the time women come back the first time or even the second time and they're like, I feel like a normal temperature. This is amazing and I love it. So I try to teach women that it's kind of that overall wellness hormone. That's how I explain it. Then there's progesterone. This is your sleep hormone. I call it the sleep hormone just so that women can kind of associate it with something. So the more progesterone you take, the better usually you sleep. Not always. Oh, I don't know if those people are coming in. Sorry, there might be. Yeah, maybe not. Maybe they were workers. But progesterone also stabilizes the mood. It also like lowers anxiety. I stopped taking my progesterone for a night and I woke up the next morning and I was like, oh my God, I feel like I need alcohol right now. And I mean, like, I can see why people are alcoholics without hormones. It's really hard. All right, so again, so you got your overall wellness hormone, you got your sleep hormone, you got your lowering anxiety hormone, your mood stabilizing hormone, which is progesterone. And then you've got testosterone. This, folks, I will tell you, is a game changer. They're all game changers because they all work together, but testosterone specifically, oh man, this is what you want. I tell you, when I am in my therapy training sessions with clinical sexology and they're like, you just need to work more with the couple. You just need to have them communicate more. And I'm like, no, but she's basically telling you she doesn't have a libido. We can't make it appear through therapy. It's just not going to happen. So I just want you to know that testosterone, this is essential to having a sex drive, having any kind of feeling or desire to want to move towards sex. And the difference between men and women is that women are more responsive desire. So a lot of women come in and they're like, give me testosterone. I want more libido, which I totally get because so do I. But you have to understand that most of the time women will see an improvement in libido when they see that they are being courted or, attended to, and all of a sudden they respond. That's amazing. And the women are like, oh, now I'm having sex more because I'm responding more to the advances. But it's not always so natural that women will have a spontaneous desire. Men have a spontaneous desire. They're out mowing the lawn and they decide it's time to have sex, and that's great. And we love them for that. Right? That's awesome. We're really happy that you do that.
Like, don't mow the
Right.
Please don't.
Oh my God. But yes, I will tell you though, in lesbian relationships, I think this is the most difficult hormone just simply because there's not a testosterone partner that's driving the intimacy in terms of sex. So it makes it a little bit more difficult to balance. So if you're in a heterosexual relationship, usually the male, yes.
Well, when I was in my master's program, part of my master's program was a sexual wellness module, and they talked a lot about same-sex couples and the difference between men and women, same-sex couples, and the drive to have sex. And they absolutely talk. There's a phrase. It's called lesbian bed death.
Yes,
And
it's a real
what ends
thing.
up happening is because the women, even when you take the lesbian couples and you get them optimized on testosterone, they still don't have the sex because it is more of a responsive type of a sex drive. That is,
Precisely.
they don't initiate, women don't initiate as much, but all you gotta do is just throw that little spark on that gasoline and it goes crazy. But if there's no gasoline there, the spark doesn't do anything.
That's right. That's a perfect way to explain it. So whenever I see women patients in my office, I try to explain to them that don't expect to be doing, whatever you're doing and then just say, I need to jump my husband's bones. Like, that's not how that works. You might feel it more in like, oh, he initiated and I was agreeable. Instead of, I want to sleep, don't even look at me. Which is very typical before you have been balanced with hormones. Now the last one, and I don't want anyone to forget about this, it's thyroid. This is your mental energy, your mental clarity, your focus, it's your memory. So if you look at all of these hormones together, right, and you think about what they give you, you don't want to do just testosterone. You don't want to do just estradiol or just one hormone. You want to do them all because, yeah, what if you have a libido but you haven't treated anything else? You're going to fall asleep the minute an advance starts because you're going to be like, God, I'm really horny, good night. That's not going to do anything. So
Did you fall asleep in the middle of that?
exactly. This brings me to my next point. So if you treat one hormone is like, one instrument in the symphony.
Harmony.
So instead, don't you want to treat every hormone so that you hear everything and you have the balance? That's the whole point of it. So that's hormones. Sorry, I had a bottom line. If you don't feel good, you probably don't want to seek pleasure or participate in any sexual activity. That makes perfect sense. If we feel like crap, nope, we are not taking my pants off. That is correct. It is sleepy time. Yep, every time. Oh, I just want to remind you. Look at all these symptoms. Oh my God, it's crazy. So this is my own opinion. This is what I think.
You're the Society of Menopause? Okay.
No, society's menopause message. I think it's like, this is very normal, guys. Just, it's okay, but it's not. I mean, it is normal, but yeah, but it's just really sad. So anyways, that's what we just talked about, how hormones affect libido. I just wanted you to always kind of know where we are in the presentation. So
normal's not okay.
no, normal's not okay, but
things are normal, but they're not okay.
that's exactly it. We do optimal here, as you know. So let's talk about the 5 things that we need for sexual satisfaction. This is part of my thesis. I have to give my husband some credit. He won't allow me to give him credit right now, but just look at him. He's already shaking his head. I talked this over with him and I was like, I really feel like it's this. And he's really good about getting words out of me and putting them in an organized fashion. So just like you. But these, I believe, are the 5 things that you need for sexual satisfaction. And I feel like The therapy world only talks about like secure attachments and the sex you're having, and healthcare only talks about health and hormones, and self might be like a health coach or something. So it seems like everybody's working in separate silos. Nobody's really working together to make a methodology that would be like life-changing. So my throat is, yes, like holistic, exactly. So,
And in the
yes.
traditional version of holistic just has 4 pieces in the bottom.
Correct, exactly.
Missing.
So what I'm feeling is like with self, sorry Clayton, I keep moving my thing here. I think you need to explore beliefs about your health. I think you need to explore what you believe is true about sex, what you believe is true about pleasure, and what you believe is true about your identity as a human. I think that is 100% part of sexual satisfaction. If you don't know the answers to these questions, you don't realize how they may be influencing the kind of sex that you're having. Because if you grew up in a Catholic home the way that I did, and if you ever touched yourself, you were going to get spanked, like you immediately associate pleasure with unacceptable or, shame. You just can't do it. Yeah. So, I mean, I've had to work very hard to understand that if I am going to have solo sex or masturbate, that I'm not going to hell. And that, I mean, it's just like such a concept to wrap your brain around. But I just want to show you, that's an example. I mean, I'm sure all of us are dealing with certain identities and beliefs about sex. The next thing that I want to move on to is secure attachment. This has to do with your relationship. I see this all the time. So many women come in and they think they just need testosterone, but they're in a relationship where their partners are not emotionally accessible and they're just not in a secure attachment. So this is what I'm saying, that both partners must be emotionally accessible, they must be responsive emotionally, they must feel safe emotionally, and engaged in the relationship. That's 100% necessary. If you don't have a secure attachment and I balance your hormones, that doesn't mean you're going to have great sex. If you still hate the person that you're wanting to have sex with, it's not going to work. The reason why I put sex on here as a separate entity is just because I'm using this as a symptom checker to kind of make sure everything else is in place. Because if you're not having good sex, there's something wrong with the relationship. If you're having great sex, probably most of the other things are in alignment. So not always, but I just want to make sure that people are enjoying sex. I want to make sure that they're content with the quality and the frequency. And I want to make sure both people are content with that.
So like physiological or biological kind of? Is that what you're trying to?
No, it's more of just like how's sex for you? You having enough? Are you happy with it? Does it feel good to you? Any issues with sex? Do you know what I mean? Like that kind of a thing. Because I'm using it as, if it's good, okay, probably at least this is probably intact. If it's not good, well then I got to go explore all these other areas and see what the heck is going on. So that was my thought with that. Obviously, we just did this. Hormone balance is, oh my goodness, it is foundational. If you don't have hormones, I'm not sure, you don't have anything else. Like this is just, it's just essential to making sure that sexual satisfaction is possible.
It's the gas in the tank. You can have a great car,
Yes.
but if you got no gas.
Yeah. You're not going anywhere. Yeah. And then lastly, health. You got to make sure you're not 400 pounds overweight. That is going to be an essential part of this, right? You've got to make sure that you're able to manage your stress. You got to make sure you're sleeping well. You got to make sure that your mental health is good. You got to make sure that you have your body respond to diseases or infections. Like, this is important. And a lot of that has to do with good blood flow, good nerves. You got to make sure that those are intact, because you're not going to feel anything if if you have like type 2 diabetes and all your nerves are shot. It's not going to work. So any questions with this, you guys? This is my attempt to show you what I will present to the world. And then you can call me Dr. Tongue. Not medically, but Dr. Tongue. We can use that name, babe. Mm-hmm. Mm-hmm. My
So I
husband.
have a question.
Yes,
So
yes, Denise, yes.
under the sex, the
Yeah.
quality and frequency.
Yeah.
What, is there a magic number for couples who have been together for a long time to what you would rate as a healthy amount? Twice a week, once a week, 3 times, 4, 5? Like, is there a average of what's rated as good?
That is, I hear that all the time in the office. No, there's no magic number. It's just, where do you feel happiest? Where do you and your partner feel happiest? And it's hard, I know, because I would compare myself to my friends, and then I was like, oh my God, I'm so not doing it enough, or, oh, I'm crazy, you know.
Yeah.
But yeah, mostly the second one. I know, let's be honest. Let's be honest. Okay. Okay, any other questions? I don't want to, yes,
Yeah,
Alan?
so, sex is better like spontaneous, not like schedules or anything like that. Like,
He's right.
It depends, okay? So everybody thinks that the greatest sex is spontaneous sex, but you know, you run into people that have crazy schedules, and you know, you talk to them about what do you do with the most important thing? Do you you show up at 8 o'clock in the morning to a great job, and you're like, I'm here at 8 o'clock and I got a great job and I'm gonna have fun today. Okay, there are people that have schedules that require scheduled sex, and scheduled sex can be just as amazingly fulfilling as spontaneous sex. So you cannot pigeonhole it into, oh, if it's not spontaneous, then it's not good.
Oh.
Just like that.
I love it. I love it. That's
Just
Just like that.
Fortunately, it just went
It,
that way.
it went down that way. That was good. That was
I'm not
good.
a doctor, but I'm
Go,
gonna
Jody,
say
go.
that if the end result is good, what difference does it make how it started?
Exactly.
Amen. Amen, sister.
As
Mhm.
long as you're happy.
Mhm.
As long as your wine falls on the floor.
And you know you're doing a good job. Absolutely. Let me see what I have. Oh, okay. I'm going to keep going just so that we don't worry. You guys are doing great.
While you're cleaning.
Go. So I had some case studies that I wanted to show you. This is, for example, this was a 62-year-old female. She was in menopause at age 42. She had a decline of libido since age 52. And the last 5 years, she's like, Erin, I am not going to have sex. I refuse to have sex. There's no way. She said she desires intercourse with her husband and she misses their sexual intimacy. She says that the responsive desire is mostly absent because he continues to just say, please, can we have sex? And she's like, no. And so she said they have sex about 1 to 2 times per year. I was like, oh, God.
Oh my God.
She says, no, I don't have pain during penetration. I don't have vaginal dryness. She said, my relationship is loving. I feel emotionally supported and connected to my husband. She said that, well, the husband was there too. And he said he reports feeling the loss of their sexual intimacy. He would rather be in a sexless marriage than without her, basically. So he said, listen, there's other activities that we can do with intimacy. It's going to be fine. We'll figure it out. And she said she just feels physically blah, like feels detached from life, no energy, lack of focus, would rather sleep than engage in sexual activities. So we balanced her, and her sex life bloomed. It blossomed because when you look at everything on that sexual pie chart, her health was amazing. She had such a great identity of self. She knew that her beliefs were in line with her wanting to have pleasure. She said, I just want to be close with my husband again. He's so emotionally supportive. And you could just tell she had all the pieces on that pie. And the only thing that was missing is she just needed some help, some hormone balance. The minute we did, boom, it was like jackrabbits. I will tell you, she was so happy. She said, oh my God, thank you so much. So that's one example. I want to give you another example. This was a girl who came in. She was 32 years old. Let me see if I can lean over here. So she feels bad about not wanting to have sex as much as she should with her new husband. She's been married a year. She has no libido. She does not enjoy sex. She has no pain or dryness during penetration. She said she used to enjoy sex with a previous partner. I feel like that is a very important statement right there. I was like, oh, hang on a minute. She said her and her partner almost broke up about a year ago, prior to their wedding. and because her husband would not establish boundaries with a female coworker. Husband scheduled online meetings with female coworker on a weekly basis. Still does. When she saw me, that's what he was still doing. Husband reports that he had a thing for this coworker prior to the relationship with the patient, but he never had a physical relationship with his coworker. So don't worry, calm down, is what he keeps telling her. The husband always tells her that he loves her and that the relationship with the coworker, it's nothing. Don't worry about it. And she feels very threatened by the husband's relationship with the coworker and reports that the coworker is physically stunning. And she feels self-conscious about her body. I'm not as beautiful or as thin as she is. And she said, does not feel like her husband is accessible emotionally. She's not soothed by his response when she talks to him. And he does not reach out to her physically. She always initiates with hugs and hand-holding. And she also says she believes she needs testosterone to help her libido. A friend recommended that she come to see me. Yes. What does everybody think? Hell no. Jeannie, that is correct. Yes. Yes. Amen, brother. And self, yes, right. She did pretty good health-wise. She wasn't doing too bad. But she had about 20 more pounds on her than she would like to have, so she was really struggling with, body identity. So that was hard for her. But I mean, I think this is a perfect example. It doesn't matter how much testosterone I give her; she's just going to want to have sex with someone that she's scared to have sex with. I don't think that's the best thing. Yes, can we make her feel balanced? All I'm trying to do is make us think about a larger picture rather than just testosterone. It's not just that, it's everything. So those are my two examples. Does anyone have questions with these examples? Does it feel like we're making sense?
So
Amen.
you don't
All right.
think that you can have a secure attachment without sex?
No, you need a secure attachment first, and then sex is amazing. Sex is okay without a secure attachment. It's just physical. But when you add an emotional component to sex,
You feel like,
right,
you
honey?
feel like that's- you feel like
He's
it's
gonna
that
kill
way
me
for
after
girls
this.
and
He's gonna be
females.
like, this is so not, oh my God.
It's like,
All right, he's like, please stop talking
Is
to
that
me.
saying she talks a good game?
Right, exactly. You don't want to hear about this. Is it true? We don't know. All right, so we've done those two things. What? Oh, I'm sorry. Alan, did you have more? I'm sorry. Go ahead.
Now we can move on.
You sure? Okay. All right, so we did those two things. Causes of climax challenges. This is really funny to me in my head, but maybe it's not right now. So I was thinking goal setting, and then I was like, how about goal sexing?
It's hysterical.
Thank you! Okay, I'm sorry. So let me ask you guys this. When you guys have sex, or if you do, what is your goal? What's your goal with sex?
many.
Go ahead and say it. Just say it.
Intimacy,
orgasm.
romancing.
Lambo. I feel like a lot of us only get into this because we're like, it has to end with an orgasm. It only can end with an orgasm. And if it doesn't, then I have failed. And this is the most ridiculous thing ever. So what this does is it takes us to the other room now. We are going to do a quick activity. Are we excited? Okay. All right. Okay. So I'm just going to start the activity and I'll tell you what we're doing, why we did this after, okay? All right, Teresa, could you start by giving Jody a shoulder massage?
Best person.
Oh, that's nice. Are you enjoying that, Jody?
I am.
Yes. Keep focusing on the pleasure there.
Uh-oh. You're gonna.
Okay, does anyone have a stopwatch?
I do.
Okay.
I like to throw it.
Just set it for 30 seconds. And if you could just actually move back even a little bit further. Just enjoy that massage. Enjoy. It's so nice, isn't it? All right, who's got the stopwatch? Okay, in 30 seconds, Jody, you've got to get as many balls in those cups, and you can't help her. Nope, you're just going to hold it still.
I
All right,
apologize in advance.
on your mark, get set, go. go. Enjoy that massage. No, focus on the massage.
Clearly I am.
Enjoy. Oh, it's wonderful. Oh, keep going. Keep going.
She's so good at this.
Oh, okay. So are you feeling kind of like you don't really know where to focus? Is it kind of difficult? You're trying to do this, but have you had? You've had enough. Yes. You can totally stop. The point of this, guys, is that when we make the point of having an orgasm, we forget to enjoy the pleasure that is actually occurring, because orgasm makes it a point that now sex has a goal. And the minute sex has a goal, you're performing. And now you've gone into the sympathetic nervous system, and the blood that needs to go to your genitals is now at your feet, your hands, your legs, it's everywhere but where it needs to be. So that brings us back into the other room. Thank you for watching this activity. We just learned it's very difficult. I've got it. Sorry, Clayton. Sorry. Okay. There. It's very difficult to enjoy pleasure if you have a goal. And it doesn't have to be an orgasm goal. It can be any goal. I know a lot of women, when I talk to them, they are so nervous about having sex with their husbands because their husbands put so much pressure on them to have an orgasm because that checks a box for them they've achieved. And that's like really stressful for women because they're like, yeah, but I really can't work that quickly. So I'm using that as an example. There's many examples, but just be aware of that with your partner. Be aware that, are you guys focused on achieving something together, which may be taking away from your pleasure? Really what I want you to do is follow the path to pleasure. Every single time you're in a sexual interaction, it's like, oh, that feels good. Oh, that feels good. Whatever feels good, just keep walking towards it. Whatever the goal is down the road, it's going to be very much worth it. But if we focus on the goal at the beginning, you can't enjoy the pleasure. I'm sure, as Jody will tell you, it wasn't as fully enjoyable while you were focusing on a goal. Okay, so we did that. Now, guys, it is movie time, I believe. I'm going to kind of preface this with, does anyone want paper to write down answers to these questions? Does everyone just want to think about it? Is that okay if we think about it? Okay, I don't want to rob anyone of a great experience. So I want you to think about what you believe is true about sex for you, for your partner, for people in general, for women, for men, for any kind of relationship. I want you to think about what you believe is true about pleasure for you. Okay, you may have some of the same beliefs that I had to work through. I want you to think about what you believe is true about sex with your partner. I can tell you a lot of women come in my office and they say, I just can't have an orgasm with my partner. I just can't. I can have it with solo sex. I cannot do it with my partner. And, something happened to make that belief set into motion. So I just want you to beware, like, if all of a sudden you were having orgasms and now you're not, this becomes an issue every single time you step into a sexual situation because you're like, what if I don't have an orgasm? And then you believe, well, I don't think I can have an orgasm anymore. And so if you think something over and over, it becomes a fact in your mind, even though it's just a belief. What do you believe is true about oral sex? I'm just throwing out stuff here. What do you believe is true about solo sex? These are just really important things, I think, for us to consider. I remember, I'm just going to share the conversation that me and you and Anna and Casey had together. We were.
Go ahead.
You don't remember what I'm going to say?
That sounds like a good one.
Well, the four of us, we have another couple that we're friends with in New York, and we were all on a Zoom chat, and I was just like, hey, like, Anna and Casey, what do you guys think about, like, masturbation and solo sex? And they're like, I don't know. Well, Anna was like, yeah, that's fine, whatever, I don't think anything of it. And Casey, what did he say? He was like, that's low, like, I don't do that. That's not something I do. I was like, oh, okay. So it's really interesting, like, not that these are conversations we're having with people that we meet every day, but it's fascinating to see what you believe is true about things that have to do with sex and have to do with pleasure. There are beliefs that are really holding you back that is really important to say, is this serving me or could I change it? So I just want, yes, Alan.
For the
Yes.
women that say that they never had an orgasm, do you think that's more of a mental limitation or versus a physiological?
Well, that's a good question. I don't think it's a physiological limitation. I think a woman can have an orgasm, but I think she needs to have one herself with herself in order to know what she likes and then be able to transfer it to a partner. For sure. That's what I would say. I think she fears pleasure. I mean, you can really put anything here. I am, or I fear, or anything with I. Here is the belief. I believe I will always be disappointed with sex. She makes that very clear. I don't think you needed to hear that from her, you know? And the habits that she has is I plan sexual encounters, I give orders, I make demands, and I control situations. You'd have to if you didn't feel like pleasure was owed to you, like it was part of the human existence. So I said to myself, what would it be like if she had a pleasure identity that was more open to her actually feeling pleasure and receiving it? I am open to new pleasure experiences. That's a huge difference from I fear pleasure. Now, I don't know, could she hop from I fear pleasure right to I'm open to new pleasure experiences? Probably not. She might need a couple stepping stones to get there, but I'm just trying to show you the contrast, okay? Here's a belief. I believe that achieving sexual satisfaction is a process. It's not just overnight, all of a sudden you're a sex god. No, you've got to work at it and work together with your partner. And lastly, the habits that she might have if she was into sexual pleasures, I meet new people, I listen, I allow moments to unfold. That's totally different, which is really nice. Oh, right, Alan? So we've done those 4 things, guys. We got one last thing to do. So routine leads to more routine. Is there a routine that you and your partner have when you're being sexually intimate? Now, here's what I mean. Babe, close your eyes. I'm just kidding. I'm just kidding. Don't worry. I'm not revealing anything. I'm not revealing anything, honey. I know Alan's getting red cheeks over there. Maybe you kiss each other. Maybe there's breast and genital touching. Maybe there's oral sex. Then you apply lube. One of you gets on top. You use a vibrator. You guys climax. Then you repeat next time. Let's also think about solo sex as well. Do you use the same hand? Do you use the same position? Do you use the same pressure? Do you use the same toy? I'm just bringing up options here. If we keep doing the same thing over and over and over, we never really find anything different that we like. So what I have for you tonight, guys, is a little take-home wonderfulness thing. Can somebody pass these out just so I don't move? Are you okay, Jody, passing them out? This is called the yes, no, maybe list. I feel like when people are doing, like when they're talking about sex, this is the only thing they ever talk about. Is, oh, no, you got to change it up. It's got to be different. And I just wanted you to know my talk tonight was not just this, but you have to include this as well. This is very important. I don't know if all of you know what everything is on this list. There might be some things that are foreign to you. But it's a great way for you and your partner to say, yeah, you know what? I could be into this. Uh-oh, we lost it. What does that mean? Do I have to do it? Okay, got it. But it's a great, I mean, like, this is such a great conversation starter because, you know, if your husband or partner or anybody wants to try anal, but you're really not into it, it's a nice direct way to be like, no, anal's not a go for me, you know? And it's hard to have conversations in the bedroom during an intimate moment. I recommend you guys go out, grab something to eat, get in a neutral environment, maybe have a glass of wine, that what usually helps, and then bring your lists and have a conversation about them because this is really, really helpful. So this is just my little gift to you guys. And I also have I have 3 other gifts to give away. We didn't do the raffle things.
Oh, crap.
Darn it, I know. How should we do it? Because I have 3 gifts, so I don't know. Should we?
Let's do it now.
Okay, is there? Okay, perfect, perfect. Okay. Oh, can I just take this off for a second? I'm sorry.
Do 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 do.
3 of my favorite books. I'm going to give them to the patients that are here tonight. Okay, I have Hold Me Tight. This is wonderful for learning about secure attachments and how to make that stronger in your life. This book is life-changing. Oh my goodness, I love it. Solo Sex. This is really helpful if you want to have some fun by yourself. You can learn a lot. And then this is Come As You Are. This is Dr. What's her name? It's Dr. Emily Nagasaki. Anyway, so Dr. Emily, she has some brilliant things to say, and she makes us females feel like we're not crazy and that what we're experiencing is normal. And she helps us feel even more comfortable when we are with men and by ourselves. So, what do you guys want? I brought you some gifts. Is there anything that stands out to you? This one?
I've actually heard of that.
Sorry, I'm really doing a bad job.
It's okay.
Vanna White.
Thank you very much.
Any of these? What's your favorite? Which one would you choose? That Oh my gosh, I'm terrible. All right, okay. And this one's up for grabs, guys. If anybody wants it, solo sex, and we won't judge you. All right. Here we go. Sorry. Hang on. Okay, guys, I think we are finally at the look, you guys did it. Congratulations! We made it! Yay!
We get our diploma.
Yes, you do. But that was it. Does anyone have any questions before we kick everybody out of here? Or would anybody like to hear more about other things? Or were there other topics? I'm just throwing that out there for the future. Just more wine.
Not tonight though.
Okay, fine.
I gotta drive.
All right, guys.
I have a quick question.
Yeah, go. Yeah.
Why do you think, as a society, we find it so difficult to talk about sex like we talk about the groceries?
I feel like this is just such a passed down tradition. I feel like if your parents were comfortable talking about it with you, then you're comfortable with it. My mother never gave me the sex talk and said that if I sleep with a boy, I will get pregnant. Like, just sleep beside him. I was like, wow, that's serious. Very powerful. So I was like, okay. But I
Put 'em on the floor.
think it has to do with your family.
But it's just so many.
It's
societal,
everyone.
it's not just individuals.
No, right. So I want to always make it a really comfortable conversation. I feel like whenever we have patients, I'm like, hey, tell me, it's cool, whatever, just feel comfortable. So I hope that we've created a little bit more comfort around this topic tonight, and hopefully with your partner, maybe you have some more comfort now too. So yeah. Anything else? Good? Are we set? Ready? Let's go home. Woohoo! All right. Thank you, guys. You're welcome.